We'll move on to the impact on minorities in with this COVID-19. So I'm just going to read off a few statistics for you because they're really telling. I'm going to do the most shocking ones. So this is from CBS. So Chicago, 70% of the COVID-19 deaths and 50% of the infections are from African American people, despite the fact that 32% of the city's population is African American. Louisiana is almost exactly the same. 70% of Louisiana's deaths and 32%, 70% of Louisiana's deaths, 32% of the population are African American. Now, this is disproportionately high. Dr. Fauci, who is kind of leading this pandemic response, at least, de facto with the White House, has said it's not because African Americans are, by nature more susceptible to being infected by the disease. I think the same way that men are. Don't quote me on that. But it's the fact that they have a lot more comorbidity symptoms, so they tend to have higher blood pressure, more heart problems, and asthma compared to the white population. And that just means that when they get infected, it's likely to be more severe. They might be more likely to go to the hospital, get tested in the first place. But at the end of the day, they are getting more impacted by this. But it goes a little bit further than just underlying health conditions. In fact, underlying health conditions might actually be explained by this next thing, which is that there are economic factors that are impacting the African American, the black community, more than they are impacting the white community. And that actually bodes well, because when you look at the numbers for Hispanic people, where am I looking at this at? Yeah. So, no, I don't have anything for that. I thought I did. I must have just not written it down. But that's okay. So, but the Latino community, it's pretty much the same thing, where they are getting infected at a higher rate than their population would say. So it's just disproportionately high compared to what one would expect or even across the board. A large reason for that is the economic factors. So African American families tend to be making significantly less money than white families. On top of that, they tend to be working jobs that are more service sector jobs. Here in New York, shouldn't probably be using that, but where I live in New York, okay, the community, the economy, the local economy is a lot of built on just service sector jobs, and I live in a very highly African American community. So what that means is that they're going out there and they're working at these jobs where they're essential workers, and they have to show up to work. And now they're being exposed to a lot more people compared to white individuals in New York tend to be working in more, affluent, higher class jobs. And so they can work from home, they can insulate themselves, and just in general, they have more money, they have more wealth, they have the savings where they can isolate themselves. So with the infection rate being higher among these African American communities, a lot of it does come down to socioeconomic factors. It's not just the fact of where they work, it's the fact that they have to keep working where they work. It's not just the fact that, not just that they're working in these locations, but on top of that, the access to information is a lot more restrictive for them. So in terms of internet access, it's very difficult for these communities to maybe get the information that they need to get compared to the more plugged-in, affluent, whites families who are out there and are able to gain access to information. It's probably one of the bigger ones. So in probably the greatest example for why this is the case, especially linking socioeconomics to infection rates, is right here in New York City, which has turned into the infection capital of the world. We weren't even close to being the first ones infected. We saw it happen in Italy 2 weeks before it even started hitting us, and we still ended up being the number one city in the world when it comes to infections. Now, there's a stark contrast in New York with socioeconomic status and the infection rate. So the top 5 kind of neighborhoods that have the highest positive test rate. So these are people who took the test, and the highest percentage, the top 5 highest percentage, the average income per worker is $26,708. So that's less than minimum wage full time, mind you. So because New York City minimum wage is $15, that means that the average income for these 5 boroughs, which have tested, that have the highest positive test rate, it's $26,708. That's less than minimum wage. So these people are already, struggling to get by in a socioeconomic standpoint. Now, if you look at the top 5 neighborhoods that have the lowest positive infection rates, their average income is $118,166. So it's nearly 4 times, it's actually over 4 times as much money that's being earned in these places that are testing positive at a much smaller rate. Now, of course, you can look at that and be like, okay, because they are more affluent, they have greater access to tests, and so people who are asymptomatic but just worried can go and they can get a test, and so that's what's bringing the infection rate down lower. But that in and of itself is a problem, that these people can get this test despite not having any symptoms and turn out negative. I think the difference was about 78% for the top 5 highest neighborhoods and like 30% for the lowest. So what you're seeing there is the socioeconomic status is a large indicator of how people are going to be faring as the virus starts to deal more damage to the community. And it's very well known in New York City that we're extremely segregated based on race and socioeconomic status, as in the two are largely one and the same when it comes to neighborhoods. There was an infographic that was going around Twitter not too long ago that was showing like hotspots for like people testing positive for COVID-19, the death rate for COVID-19, and then also they were doing it based off of how much money these places were making and kind of the racial composition of these places, and they all like matched up perfectly. So these neighborhoods that are making less money tend to have higher concentrations of people of color, just there are more of them living there as a percentage of the population, and they're also testing positive more frequently and dying from this. So it's all linked together. And this is the case study for it's right here in New York. It doesn't, there's this whole thing on like liberal Twitter that's like, oh no, this virus, it doesn't look at your skin color, your socioeconomic status, it affects us all equally, and so we all need to come together. It's like, that's factually not true. It's empirically not true that that's the case. People who are wealthier are able to hide themselves away. They're able to just lock themselves in their apartments and just order food nonstop, order groceries nonstop. Meanwhile, the people who have to go out to work are the ones who are getting them their groceries. They're the ones who tend to be people of color who are going out there and doing the shopping, picking up the food, delivering it to the to whatever the apartment, often doing no contact delivery where they just like set it down and leave because because the people who are in the apartment are they're able to restrict themselves from going outside at all. While other people who don't have savings set up, who don't own their apartment, who are still paying rent because Governor Cuomo didn't enact a rent freeze or a rent, kind of waiver, they have to go out there, they have to keep working, and they're just going to be more likely to be exposed to the virus. And it's a travesty that this is the case, where in a city that is like a liberal beacon is kind of the hotspot for the racial and socioeconomic disparities of this virus. But of course, beyond that is how it's affecting communities that aren't quite hard hit yet. So pretty much everywhere in the country, I would assume, I believe at this point, all the public schools have gone to online learning. So you're no longer going into a school with 200, 300, 400 students sitting in classroom with 30 other kids and learning. They're all online. But that poses a lot of difficulties. Now, if you're in college and you're doing online learning, it's not that big of a deal. Maybe your professor does like a Zoom call, just records a lecture. It's easy stuff. You know how to handle yourself. But when you're not in college, so if you're in high school or middle school or elementary school, it can be very difficult to gain even access to these resources. And a lot of that has to come from the fact that broadband internet is not widely accessible. So let me pull up what stats I have on here. Yeah. So there are 12 million public school students in the United States do not have access to broadband internet, which means that if schooling is online, these 12 million students cannot get access to schooling. There's just no possible way for them to do it. And so there was like a question or a breakdown of how many of these students are like actually attending their classes or doing their work. So it's moved online. It's a lot easier just kind of slough it off. If you're not showing up there and you have to turn in the homework physically, it's easier to put it to the side. And 41% of teenagers, specifically 47% of those in public schools, said that they have not gone to class since their school moved online. And now that some schools are on spring break, and so, like, yeah, of course, some of them haven't gone to class since school's moved online because they haven't had class since they moved online. But that number actually spikes. They don't have the racial breakdowns for African Americans and Latinos for whether they're able to show up for class or whether they're doing so. But when it goes into the racial breakdown for how worried they are about their educational prospects, 66% of African Americans and 70% of Hispanic students are worried about their educational future. And that makes a lot of sense, because if we have 12 million students who don't have access to internet, those 12 million students are probably in large part students whose families don't have the money, don't have the resources to afford internet. And the ones, like I've said, who have the lower wealth within their families are African American and Hispanic students. So if they're worried about their educational prospects, it's likely because they don't have access to internet, they don't have access to these resources that maybe their more affluent peers are having access to. But it kind of goes further beyond that, which is if you are a student who is trying to get into good schools, it's your junior year now, you're approaching your senior year, and you're kind of frazzled trying to prepare yourself for the application period, like, you need to be in school talking with counselors and have them walk you through it, get teachers right there with you a lot of ways. Like my dad went to college, my mom didn't, but even then I was still reaching out to teachers a lot to help walk me through the process and get them to write me letters of recommendation. So these students who are juniors or even sophomores, maybe they're worried about how standardized testing is one of the things. I don't think they're doing any standardized testing for the next while. So there are just a lot of students right now who thought they had a system in place, a plan in place, who now are unable to do it. And the students who are, as we're seeing here, the ones who are most worried about this, probably rightfully so, are African American and Hispanic students. So we're just seeing how disproportionate this virus will affect different communities. We'll see it play out more and more as we start to see it infect jails. Rikers Island right now is the number one. If you break it down even beyond city and further, Rikers Island has the highest infection rate in the world by 1.5 miles. So we're going to be seeing probably within the next month or so this infect other jails, which are largely inhabited by African American individuals, from the systemic racism through the police targeting and court system. That is, it's just going to continue to be a problem down the line, and we'll see that manifest itself. So when you hear people say, "Oh no, this affects everybody equally, nobody's," it's just not true. And you can't listen to that. All it's doing is it's a distraction from understanding that no, this is a real problem. And in fact, it's not like it just brought up these problems. These problems have always been here, but people will just turn their blind eye and ignored it entirely. We're now seeing years of systemic injustice from the top down come right up and start to affect these communities in ways that are just horrific. So let's hope that we get some changes, but we'll see.